Okay, let's take a look, everyone, at some endocrine disorders. So some of the biggies that kind of stick out. If we look at the right-hand side right here, this is called a goiter, and a goiter is really a general term that's used to describe an enlargement of the thyroid gland. Um, Here on the left-hand side, we have a 22-year-old man who whose pituitary was pushing out a lot of growth hormone, and as a result, you have giantism. You grow much, much taller than the average person. When you're an adult and you have an excessive amount of growth hormone during adulthood, you get a condition called acromegalia or acromegaly, which is where you have this very thickened brow, you get the thickened jawline, you get features of like a caveman type of appearance. If you look down in the center on the bottom, notice the eyes. You should not see the white of the eye all the way around, right? In most people, you see the top of the lid covers the upper portion of the eye. When you can see the bulging eyes and white all around it, there's a term for that called exophthalmos. That is seen with Graves' disease, which is a hyperactive thyroid, a hyperactive thyroid. So this is exophthalmos. Again, you could see the white all around the eye on both eyes, exophthalmos. That's due to the excessive fat accumulation behind the eyes, pushing the eyeballs out. Cushing's disease or Cushing's syndrome is a syndrome that's caused by the prolonged exposure of either endogenous or exogenous glucocorticoids, right? So this is cortisol levels that are very high in the body. And when cortisol levels are very high, you get this very round face, you get these red cheeks, you get this buffalo hump on the back, you get red stretch marks, they're called striations or purple striae. You get this large pendulous belly. There's poor wound healing. And the arms and the legs are always much thinner than the midline, right? They had this large, big belly, and then the legs and arms just don't match up, okay? So here on an individual, we can see the round moon face. We could see the purple striae. We could see the stretch marks here, purple striae, and we could see the buffalo hump right here. Sometimes the buffalo hump is not always predictive of Cushing syndrome. It could also be pre-diabetes. Also pre-diabetes.